My name is Ben Miller, as you guys know, and this is our peer recovery support presentation. Jonathan, do you want to say anything before we start?
No, just thank you for the introduction, Jamie and Nicole. We really appreciate the opportunity to speak, and we're looking forward to presenting a little bit about what peer support is, and then we're going to share a little bit of our personal journey. So, thank you.
So, one of the goals of peer support is to inspire hope. Hope for peers may initially seem elusive, often due to the complexities of mental illness and the societal misperceptions regarding positive mental health outcomes. A peer recovery supporter is a living, breathing example that illuminates the reality that recovery is possible. Peers are presented with a support person who not only understands the intensity of psychosis firsthand, but has also displayed the resilience to recover. This witness of recovery restores peers' confidence to consider what their own aspirations and dreams are for their lives.
Next slide, please. So, peer recovery supporters also share their lived experience to foster connectedness and build relationships. Healthy lives are lived in community with others, and interconnectedness and relationships are vital to well-being. A peer recovery supporter sharing lived experience breaks down the walls of stigma and isolation and illustrates to peers that they are not alone. Shared lived experience often provides a sense of inclusion and creates a non-judgmental setting. Peers are able to transfer their experiences working with a peer recovery supporter into other elements of their life, fostering connectedness to others.
Peers also listen to and understand peers' experience. Oftentimes, as a supporter, we need to ask ourselves, why are we talking? Many times, as peer recovery supporters, we may not have all the answers, and listening may serve as the best strategy to help a peer grow. Listening is a vital tool in understanding where the peers are, where the peers we are working with are at. Peer recovery supporters may serve as a bridge to direct a peer to avenues of recovery of the recovery team, such as a therapist, doctor, or family member.
Peer recovery supporters also assist peers in options and overcome barriers preventing them from moving forward in recovery. Many times peers face difficult obstacles on the path to recovery. Sometimes symptoms may not always entirely be in remission, side effects may be challenging, and at times the expectations for wellness may not be obtainable in that moment. A supporter may need to remind peers that recovery often isn't linear. There are many sideways, ups, and downs. A supporter may directly witness to the advantage of the medication adherence or abstinence from substance use. Despite adversities, supporters often illustrate that there are always options and peers have the autonomy to choose their own path in recovery. A supporter models healthy behaviors and coping strategies such as walking, journaling, talking with the loved one, etc. These model behaviors also help expand the horizons of peers to respect bigger possibilities for the future of their own recovery.
Peers also provide person-driven support that taps into peer strengths related to illness self-management. Every individual has their own strengths and coping strategies and how to best deal with the adversity of having a mental health diagnosis. Many times, supporters point out particular strengths they see in peers to encourage them that they have their own resources to manage hard times. Many times, a supporter may point out and remind a peer what they like to do to help manage the challenges of their illness. This may help cultivate personal validation, decreasing negative feelings towards self, and reinforce consistency and positive behaviors.
Peer recovery supporters also assist peers in developing strategies to communicate with and advocate for themselves. Peer recovery supporters do not dictate recovery decisions or directly provide advice. Rather, they encourage autonomy by simply serving as a model of what is possible. A peer recovery supporter may open the door to other avenues of healing, such as DBT, the 12 steps, NAMI, or psychotherapy, which a peer may decide to pursue independently. A supporter's self-disclosure of having a mental illness may help lessen stigma and guide a peer's decision about their own personal choice and disclosure to family, friends, or employers. Self-disclosure can be a scary time, and peers may need extra support at that moment.
Peer recovery supporters also support peers in implementing a relapse prevention plan. Stress can often serve as a trigger. Many times a supporter may provide insight into understanding how lack of sleep, substance use, or neglect of self-care can trigger a relapse. Supporters may assist peers to connect to resources such as supported employment or housing. Peer supporters are many times resource guides, connecting peers to wellness centers, case managers, support groups, or transportation resources to enhance recovery.
Peer recovery supporters assist peers in adopting a proactive role in their own behavioral and physical health. In the Wellness Center at GCB, there are groups like self-care, diabetes support, gym outings, etc. These groups help give clients tools to take control of their own health. At Catholic Charities, a peer recovery supporter may actively participate directly in the health of a peer by modeling healthy eating habits, going on a walk with peer, or shooting baskets with the peer.
So now we're going to talk a little bit about our stories, if that's okay, and kind of what we do day to day on a peer recovery supporter level. So I'll start first. So I became a peer recovery supporter a little over 2 years ago. I work at Greater Cincinnati Behavioral. I've been a client of Greater Cincinnati Behavioral for about 5 years now. So my story is back in high school, I started having severe panic attacks, and I didn't get help and I didn't get medicine. I didn't get help for any of it. Until I came home from college one semester and I started believing that this is when my psychosis started setting in. I started believing that the second coming was going to happen. I was really into the Bible, really into religious kind of theories and stuff like that. And I started believing that I was going to lead America in the second coming. My parents, they took me to the hospital, and this was the second time I'd gone to the hospital. The first time was for anxiety, and they got me help. And when I got out of the hospital, the first doctor I saw told them, when I wasn't in the room, they told my parents that I will never have a job, and most likely will never have a job, and never be able to finish school, and not be able to really have a productive life. And I also learned recently that he also told them that I will most likely be homeless after they pass away. So my parents were devastated, and so they didn't like the doctor's diagnosis. So my aunt actually saw an ad for Greater Cincinnati Behavioral, and my parents they got me help at Greater Cincinnati Behavioral because they didn't really like the doctor's diagnosis, although they believed him. And so I started getting help at Greater Cincinnati Behavioral, and I had a case manager, a job coach, a therapist, a family support worker, and a psychiatrist. And so I started getting help. And at that time, I was really, I wasn't speaking much. I wasn't doing much. And little by little by little, I started socializing more. I got a job at Walgreens, and then I got another job after that, and I worked at Papa John's for about 3 years. And then my job coach suggested, hey, have you heard of peer recovery support? And I said no, and I started looking into that, and she said it might be a good idea. It might be an opportunity for me to share what I've gone through with other people. And so I completed the peer recovery support training, and I applied for a job at at the wellness center where I am a client at Greater Cincinnati Behavioral. And I got the job, and I've been working there for a little over 2 years. And so what I basically do day to day, kind of before COVID, I do groups with adults with mental illnesses. They come in to the center, and we do groups like self-care. We go on outings, we go to the gym, we talk about diabetes support, we talk about other things. And it's a real good setting to foster social interactions, because we have a lot of clients that come down here every day. And we also do we did do one-on-one peer recovery sessions where we would talk, one-on-one with them, and help them through shared experience, kind of what helped me and what helped them. And that was really beneficial. And when COVID kind of happened, we had to redo things. Now we have like a tent outside of our office where we do different activities. It's not as private, not in a private setting, but so that's kind of what we're doing now, and we're hoping to get back inside eventually at some point, but taking necessary precautions. But yeah, that's a little bit of my story and what I do day to day. Thank you guys for listening.
Thanks, Ben. My name's, as stated, Jonathan Clemente. I'm peer recovery supporter for Catholic Charities, and for me, well, I started to experiment with drugs and alcohol in high school, and I took risks and stuff, and probably indulged in substances that probably wasn't advisable. And I started to have some symptoms in college and stuff, just like general paranoia. But I sort of, and then around the age of like 23, I started to break out in have some serious psychotic symptoms, like when I would smoke marijuana, and it kind of forced me into a place where I made the decision to quit using all substances. And through, I was able to do that through a 12-step group, and I got sober from drugs and alcohol. And I just thought to myself, okay, like, as long as I don't use drugs and alcohol, like, I'll never have to deal with that again. Like, I just thought it was like a consequence of my use. And unfortunately, that wasn't the case. After about multiple years in recovery, I started to study for this exam and stuff, and the anxiety built up so much that I alerted my parents to their concern grew, and they suggested I go see a doctor. And the doctor wanted to introduce me to antipsychotic medication, and I didn't believe what he was saying. And about my mental health, he told me that I had a psychotic disorder, and I didn't believe him. I thought that he was working with the devil and stuff, and I just thought that it was just like some strange, like, he just wasn't reading me the right way. And so I resisted. I did take the medication for about a year, but after about a year, I fought it, and I was able to get off the medication, and I just thought I could go on my merry way, and that, nothing, adverse was going to happen. And after a few years of being off the medication, I digressed, and I ended up in a full-blown psychotic episode. I was working a job as a graphic artist, and I was not sleeping very well and putting in long hours and stuff. And then, and I started to build up a very intense paranoia about my supervisor, and I thought that he had been monitoring my internet activity. I thought that he had put bugs on my car to track where I was going in the city. I thought they had put like a weight on my chair to discern when I was taking my break and when I was at work. And I started to think then that, like, celebrities were tweeting about me and things like that. And then one day I woke up, my parents cautioned me to live with them for a little while. And I woke up one day in their house, and I thought that my dad had a gun, a loaded gun, in the room next door, and that he was going to come into my room and shoot me with the gun. So to make a long story short, I ended up, in the hospital, and I was hospitalized for a couple of weeks, and then I went to a place I had the privilege of going to this place called Hopewell Farm. It's like a psychiatric kind of rehabilitation place for people with serious mental illness, and it was the best thing for me. I was able to stabilize on medicine and get used to medicine that like diminished some of the more adverse side effects and stuff. And I was able to kind of get my bearings and sort of process what had happened to me and try to come back down to reality. And this time I accepted that I had a mental illness, and it was not an easy pill to swallow. I struggled with depression and stuff during the time, but having the support of the community there was vital. And they encouraged me to apply for new work. They wanted me to have a job that was maybe more respectful of like my condition and stuff. And so I started to go online and look for, part-time jobs. And I went to the Catholic Charities website, and I saw like, the little advertisement, and it said, that they wanted somebody that had lived experience either with mental illness or drug and alcohol or both. And I happened to have both, so I thought I was perfect for the job. So I applied, and I got the job, and I've been doing it for the last 2 years. It's been a great job for me. I've learned a lot about my own recovery, and I've been able to try to help other people recover from, I work for a FIRST team, which is first interventions, first episode of psychosis. So we try to catch guys that have recently had their first psychotic break and try to wrap them in services and try to like promote their well-being so they don't fall into a downward spiral. A typical day for me is I would go out to a peer's home, and we would, right now because of COVID, we've been doing a lot of walks outside. So sometimes we just walk in the neighborhood, go meet for coffee, maybe go to a chapel. I kind of allow the peer to guide me in the way they want to use the time. And so some of them have different interests and activities. Sometimes we might go shoot hoops. Sometimes we might just go for a walk, get coffee as stated, or, one of my peers is really into like spirituality. So we've been going to visit like prayers, chapels and stuff. And I've been trying to link him up with some spiritual direction and stuff like that. So yeah, that's a little bit about my story and what a typical day is like. Thank you.
Thank you both very much.